Hello, my name is Diana, and I'm going to provide you with an example of an SBAR between a nurse and a physician. Okay. May I speak with Dr. Patella, please? Hello, Dr. Patella. This is Diana Crossland. I'm a nurse at the UNMH Family Practice Clinic, and I'm calling you with a non-emergent situation concerning a new patient, Patricia Reynolds, and her request for a prescription of Celebrex for right knee pain, stiffness, and swelling. May I give report? Thank you. Ms. Reynolds is a 50-year-old Anglo-female occupation lawyer who presented today, March 3rd, well-dressed, groomed, and oriented ×4, but with a somewhat rushed and impatient overall demeanor. Temp 97.7 Fahrenheit, respiratory rate 18 and unlabored, lungs clear ×4, heart rate 75 with a regular sinus rhythm, S1, S2 heart upon auscultation, blood pressure 122/80 with 2+ peripheral pulses and less than 2 cap, refill ×4. O2 sat 97 on room air, and she's reporting being in her early stages of menopause, experiencing irregular menses. The patient's present complaint is that of a gradual 12-month onset of right knee pain, which she describes as being dull and achy in nature, and she reports that pain at being a 5 out of 10 upon examination. She reports an increase in pain to about a 7 or 8 in the mornings, and after working all day and after playing tennis. She reports no history of acute injury to her knee, and upon examination showed no lacerations, bruising, or increased tenderness indicating acute injury. In addition, she reports occasional left elbow pain rated at about 3 upon occurrence. Her history includes a living mother with osteoarthritis and a father who died of a heart attack at 75. No other relevant family history was reported. Patient reports an allergy to sulfa drugs and a history of hypertension, which is controlled well with low pressure. Her reaction to sulfur drugs is hives. Patient currently self-treats her pain daily with an approximate 800 milligrams of Motrin 3 times a day. She reports using ice and elevation as well to ease her pain, and she denies smoking, recreational drug use, or self or family history of depression. Her BMI was within normal limits today at 23.3, but she did report a very poor diet consisting of pretty much coffee for breakfast and lunch, and then she said whatever's in the fridge for dinner. She reports a wine intake of 2 to 3 glasses per night and denies any other medication usage and does not take vitamin supplements. Thank you. So I've just assessed the patient, and taking into consideration all the factors that I just reported, I believe the patient's current complaints are osteoarthritic in nature. I do have recommendations, thank you. Due to the history of sulfa drug allergy and hypertension, the requested Celebrex prescription is not a viable option for this patient. Instead, I recommend that Ms. Reynolds receive osteoarthritis screening, beginning with x-rays and some blood work. In addition to providing the patient with education on the effects of alcohol and nutrition on her bone health, I recommend a nutrition consult to address her nutritional needs of menopausal age women. Furthermore, I recommend performing a CAGE assessment to determine her possible ETOH treatment needs and providing education to her on the concerns of combining alcohol with her current blood pressure drugs and NSAID usage. While awaiting the test of the results and subsequent treatment options, I encourage the continued use of rest, ice, compression, and elevation to ease her knee discomfort. And lastly, due to her pain ratings and symptoms, I support her daily Motrin usage, and providing additional patient information is important on NSAID side effects, especially with regards to her alcohol usage and her high blood pressure. Yes. Okay. Okay, so just to reiterate, I'll pull her labs, I'll perform a CAGE, I'll patient educate on all areas indicated, I'll get her rescheduled for next week, I'll send her to x-ray today, and in addition, I'll inform Ms. Reynolds of a recommended Motrin dosage use of 400 to 800 milligrams orally every 6 to 8 hours as needed for pain? Okay, wonderful. Thank you. Have a good day, Dr. Patella. Bye-bye. So that's it. SBAR, Situation, Background, Assessment, and Recommendations. Bye.